New at 10, breaking the stigma of mental health in the African American community. Our Taylor Lumpkin shows us why local health and faith leaders talk about the importance of asking for help.
Milwaukee leaders came together to empower men to become more aware of their mental, physical, and emotional health, while also telling them that it's okay to ask for help.
We have to save ourselves. We can't wait for anybody to come save us.
It's a mission that's close to Milwaukee pastor Clem Richardson's heart, helping black men in the community pay more attention to their health.
We're bringing solutions, and we're bringing love, and we're bringing information.
That's why he and other leaders of faith, as well as community organizations, got together to host a men's health night. They talked about stress, mental health, and other issues that aren't typically discussed among men.
You know, as men, we're taught to be strong, to not cry. A lot of times that we take on a lot of things and we just hold that stuff in, you know, without being able to get it out.
There was plenty of fellowship and some tough conversations.
The stigma is if you talk about your mind or there's some issues, you're considered what you say crazy. We're trying to figure out how do we break those barriers.
According to the National Institute on Minority Health and Health Disparities, black men are 4 times more likely to die by suicide than black women.
You kind of suppress a lot of things that you feel. When they do ultimately come out, they come out in the wrong way. They come out in a violent way. They come out in a substance abuse way.
Which is why leaders say it's critical that these types of conversations continue to happen in the community.
But it's going to take us men. It's going to take us men, as we're doing, come together to have these conversations to say, tell me why you're not talking about these issues.
Reporting in Milwaukee, Taylor Lumpkin, TMJ4 News.
Taking a closer look at this issue, black adults living below poverty are more than twice as likely to report serious psychological distress, and depressive symptoms among black people are more disabling, persistent, and treatment resistant than they are among the white population.